Create a captivating video presentation on diabetes, the silent epidemic. Introduction. Diabetes, often referred to as a silent epidemic, is a metabolic disorder that has become a major public health challenge globally. According to the World Health Organization, WHO, over 460 million people worldwide live with diabetes, and this number is expected to rise to 700 million by 2045. In this presentation, we will delve into the world of diabetes, exploring its types, causes, symptoms, diagnosis, treatment options, and management strategies. Our goal is to equip you with the knowledge and skills necessary to understand and manage this complex condition. By the end, you'll have a deeper appreciation of how this condition can be tackled effectively and compassionately. Types of diabetes. 1. Type 1 diabetes, an autoimmune disease in which the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas, resulting to insulin deficiency. 2. Type 2 diabetes, a chronic metabolic disorder characterized by insulin resistance, where the body cells do not respond to insulin, thereby hindering glucose entry into cells, and impaired insulin secretion, where the pancreas gradually become unable to produce sufficient insulin the body needs to optimum functions. 3. Gestational diabetes, a type of diabetes that develops during pregnancy, usually in the second or third trimester. 4. Latent autoimmune diabetes, a form of type 1 diabetes that develops in adults, often after the age of 30. 5. Maturity onset diabetes, a rare form of diabetes of the young, caused by genetic mutations that affect insulin production. Causes and risk factors of diabetes include 1. Genetics. Genetic predisposition and environmental triggers, such as viruses, play significant roles in the development of type 1 diabetes. 2. Obesity. Excess body weight, unhealthy diet, and physical inactivity increase the risk of developing type 2 diabetes. 3. Age. Risk of developing type 2 diabetes increases with age, especially after the age of 45. 4. Ethnicity and family history. Certain ethnic groups, such as African Americans, Hispanics, Latinos, and American Indians, including very close family history of type 2 diabetes, are at higher risk of developing diabetes. 5. Health condition. Pre-existing health conditions like hypertension can increase the risk of developing type 2 diabetes. Symptoms of diabetes. The common symptoms are increased thirst, hunger and urination, fatigue, blurred vision, slow healing of cuts and wounds, and tingling or numbness in hands and feet. Diagnosis of diabetes. The diagnostic tests include fasting plasma glucose, FPG, test, oral glucose tolerance test, OGTT, and hemoglobin A1C, HbA1c test. Complications of diabetes. There are short and long-term complications. Short-term, hypoglycemia and hyperglycemia. Long-term, cardiovascular disease, nerve damage, neuropathy, kidney damage, nephropathy, eye damage, retinopathy, and foot problems. Prevention of diabetes. The major way to prevent diabetes is through lifestyle modifications. The modifications can be achieved through healthy diet, regular physical activity, weight management, and stress reduction. Regular monitoring of blood glucose levels, HbA1c, and other health parameters, as well as regular follow-up with healthcare providers, are important in effective prevention of diabetes. Management of diabetes. Diabetes can be managed with drugs. They include oral drugs such as metformin, sulfonylureas, and pioglitazone. There are injectable drugs like insulin and receptor agonists. Conclusion. In conclusion, diabetes is a complex and multifaceted condition that requires a comprehensive approach to management and care. By understanding the types, causes, symptoms, diagnosis, prevention options, and management strategies for diabetes, we can work together to prevent, detect, and manage this condition, thereby improving the lives of millions of people worldwide. Thank you for joining us on this journey into the world of diabetes.